Hi, everybody. My name is Dr. Uejin Kim. I'm a Christian psychiatrist who cares about what's right with you than what's wrong with you. In this video, I'm going to be introducing the concepts that I used in my online course called Be Still to move forward. I have another video that I described 5 most common obstacles to starting and continuing talk therapy. So if you're interested in that video as well, I'll put a video description down below. But in this video, I wanted to really introduce you my mastermind in my head that I had to create this course. So in this course, there's 5 modules, but really I'll be talking about the middle 3 because first one is introduction and the last one is summary and kind of celebration party. So I'll be kind of talking about the middle 3. Now, first of the 3 is really using a very effective and efficient and evidence-based cognitive behavioral therapy exercises to really understand what's going on in our minds, especially when we made a mistake or when we felt depressed or anxious or overwhelmed. So I will be introducing concepts like cognitive triangle or cognitive triangle dysregulation or cognitive distortions, and using the thought reframing exercises to really help you understand, to break down your understanding of what's going on in your mind so that you'll be in touch with yourself and understand, so that not only will you understand what's going on in your mind and why you felt that and why you did that, but slow it down and really check and reframe the thought processes that you have so that there's more fairness and grace for yourself, even when you make a mistake and even when you feel overwhelmed. I do these exercises in my workshops and the results are incredible. A lot of times the clients come in feeling overwhelmed and maybe 10 out of 10 anxious and lonely. And within 20 to 30 minutes of doing this exercise with me, they feel hopeful, they feel open, and the reduction of anxiety and feeling overwhelmed goes from 10 out of 10 to maybe 2 out of 10. It's amazing. Now, the second of the 3 is getting in touch with our inner child. And this is my baby because I created this concept. In psychiatry training, especially, we lack a lot of training in therapy because we have to learn how to manage medications. But also when I talk to my colleagues and therapists, the spiritual side of mental health healing is missing in our training. But I realized that getting in touch with our spiritual self and human-to-human connection that I provide with my patients was a huge component of healing and them getting better. So I started to think, how can I bring this into a self-paced online course? And I think the processes of getting in touch with our inner child, I think, provided that result. So the middle one, we're using the same situation that we were analyzing in the previous module, but we're bringing it here so that we can ask gentle and nurturing questions not only to ourselves, but we're going to be time traveling to our childhood memories to really see our inner child in that moment. Some of the feedback was, whoa, I did not know that memory was there. Yeah, this is the first time that my inner child felt seen and heard. And this brings so much healing for them. A lot of times people cry. It's a tear of relief that, wow, I'm gently taking care of myself and my inner child. And the last of the 3 is parenting our inner child module. Now, this concept came because of a few findings. Number 1, a lot of people, I would say most people, didn't get adequate parental attention and nurture during our childhood. That left a lot of things unsaid about ourselves and what we need to do and what we should do and what we don't have to do. So this level of confusion needed to be clarified a lot of times when I'm talking to my patients and my clients. Second fact is that a lot of times we were parented and guided with list of do's and don'ts. There was no exploration. There was no curiosity-driven troubleshooting. So a lot of times we have this sense of, oh, this is wrong and this is right. I shouldn't do that. I should do that. That limits from individual journey of exploring the whys and the hows. So the inspiration of this parenting module, parenting our inner child module, came from the book, How to Talk to Kids So They Listen and How to Listen to Kids So They Talk. This is a very warm, nurturing parental tools in the toolbox book that I recommend. And I read this book before I had my first kid. And I'm getting some of the exercises in that book so that we can apply to our inner child and to ourselves so that we can be creative, we can be mindful, we can be protective as we are troubleshooting our mistakes and maybe habit patterns that we want to fix. So no longer guilt and shame associated with, oh, you shoulds and should nots. We're really exploring all our solution options freely and without shame and guilt. So one example of this module was one client said, oh no, I can't confront them. That's not right. But we actually went through the module exercise and she said, actually, confronting them is the best option, but with grace and with kindness. So I don't know if you're like me, but I make similar mistakes over and over again, or I get triggered by similar situations. So this module will be a really good way to take a time out from life and really assess these patterns so that next time it happens, you'll be reacting a little bit differently, but with parental and nurturing and gentle way of assessing and troubleshooting. So this was an introduction for the 3 powerhouse modules in my course Be Still to Move Forward. As you can see, it's a lot of heavy lifting in regards to jumpstarting your mental and spiritual health journey. So if you're interested, I'll put the description down below so that you can jumpstart your journey.